Hello there, I'm Dr. Ezine, and welcome to today's video. This one part three of video series on primary health care, the foundation. Okay, so in today's video, we'll be looking at the planning for primary health care. Before we go on, if you haven't watched the other videos, just go to the description box below and click on the link to watch the previous videos before you come back to this one. So in today's video, like I said before, we are going to be looking at planning for primary health care. Okay, we are going to explore the essential components of planning, emphasizing the need for strategic thinking and community focused initiatives. So the first step in strategic planning, of course, is to anticipate the needs, okay, to help health systems anticipate and address present and future health challenges. It's also going to look at focuses on setting long-term objectives. Okay, when you want to plan, you have to set objectives. Then you design interventions and also efficiently allocate resources. Now, when it comes to planning, you first want to do a situation analysis to find out what is going on before you actually carry out any program there or implement anything. And we can do that through the SWOT and gap analysis. Now, this SWOT analysis examines internal and external factors influencing the system. So you have to look at SWOT means the strength, the weakness, the opportunities and threats already existing already that the committee has. Then gap analysis identifies discrepancies between the current state of the health system and the desired outcomes. Okay, what is the gap and how to close the gap? Pinpointing areas that require intervention, of course, to close this gap. This has been explained in detail in my upcoming book on primary health care, the foundation. Okay, so you go ahead to click the link in the description box below, and it's very affordable for you to be able to get and have it in your library. Now the next thing is, after you have identified what the problem is, what the challenge is, and what needs to be done, you have to set goals. Okay, you have to set goals. If you do not set goals, you will just be working without a focus. So first of all, you have to know the vision, mission, provide direction and purpose for the primary health plan, outline the future state of healthcare that you want and the objectives driving the initiative. Set an agenda for primary health initiative with goals representing broad long-term outcomes and objectives being SMART. Okay, SMART means specific, measurable, achievable, relevant, and time-bound actions to achieve the goals that you have set, not just setting, oh, I want to bring down the rate of mortality. Okay, you have to say by what time you want to do it, how do you want to measure, by what percentage do you want to do to bring it down from and to. Okay, so if it's from 80%, want to bring it down by 30%, or you want to bring it down by 50%. So you have to state those, make sure that the goal you are setting is smart. Then next is to prioritize health needs. Okay, which health needs is most essential and which one is least. Okay, so you do it that, so it ensures that limited resources. Remember, inadequate fund is one of the challenges facing primary healthcare. So it ensures, that limited resources are directed toward the most urgent and impactful health issues, considering their urgency, feasibility, and impact. Okay, so that is what you have to think of first. Next is to now develop effective primary health care policies that will go ahead to achieve this goal. So policies should have clarity of purpose. That means it should have well defined objectives that address specific health challenges. That's why I said it should be smart. Your goals, your objectives should be smart. It should also have evidence-based foundation. Okay, so effective policies rely on accurate health data, not just anything that is found online, but accurate health data on the community that you are trying to implement whatever intervention. Research findings and best practices are also required. Now we have stakeholder engagement and community participation. They come together to collaborate to bring about a healthy outcome. So committee members, the stakeholders are involved. Of course, at the committee members, we have the families, We have the local leaders and vulnerable groups that are involved. We have the healthcare providers such as you and I, if you're in public health workers, community health workers, traditional healers, doctors, nurses, and then we have the policy makers, those in the Ministry of Health, local government officials, public health authorities. They come together, okay, and bring about this implementation of the plan. So what are the benefits of stakeholder engagement? Number one, relevance and sustainability. Engaging stakeholders ensures that each health intervention that are brought to address the community needs will be well implemented because each have their roles to play and are more likely to be sustained over a long period of time. Then we have collaboration and resource sharing. Okay, the stakeholders can come together and put their resources together and expertise to achieve shared goals. When it comes to public health or primary health care, you can one sector cannot just achieve it. Okay, remember we're trying to achieve universal health coverage. Okay, they have to come together, put their resources together, and bring about a healthy community. Then there's trust and ownership. Inclusive planning fosters a sense of community ownership, especially when you engage the community members. Okay, it helps them, increase their trust, leading to greater commitment to health initiatives. So looking at community participation in primary health care, we have informative participation where information is shared about health programs and policies. You have consultative participation where you gather community feedback and you now incorporate it into planning. And of course, you cannot gather community feedback without engaging the community members. Then we have collaborative participation between stakeholders where they work together in program design and implementation. Then we have the empowered participation, handing over decision making power to the community. What are the challenges in stakeholder engagement? Of course, number one has to be the power dynamics. Some stakeholders may dominate decision making and sidelining others, like what we are seeing in our country, Nigeria, where the politicians are sidelining the others, especially the community members who are supposed to be actively involved in this planning of their primary healthcare center. For goodness sake, is going to be in their community, and if you are not engaging them, then how do you expect to achieve universal health coverage? Limited capacity. Okay, communities may lack the skills and knowledge to participate meaningfully, and that's where training comes in. Okay, we also have, of course, inadequate funding, resource constraints for stakeholder meetings, participatory meetings, and all that. We have resistance to change. This now is from the community. There's cultural or political resistance, which may hinder participation effort. Then what are the key takeaways from today's video, which is a quick one, by the way? We have known that effective primary health care planning requires a comprehensive approach. Okay, it's a holistic approach that prioritizes strategic thinking. We have to plan effectively, have smart goals, be to carry the community along, community engagement and evidence-based decision making. Okay, gather relevant data to be able to implement effectively by involving all relevant stakeholders, the community members, the healthcare workers, the workforce, and the politicians, policy people in the ministry and all that. Utilizing data-driven methods and adapting to changing needs, health planners can create a sustainable and equitable health outcomes for a diverse population, including the rural, urban population. And that's all for today's video. If you gained something or you have any questions to ask, leave it in the comment box below. Remember to get the book on primary healthcare, which is also, the link is in the box below. Don't forget to share, like, and subscribe to my channel for more academic content such as this. See you in my next one. Bye.